Welcome back. New at 5:30, a 17 News exclusive as we hear from Dr. Deborah Burks, a leading member of the President's COVID-19 task force, about her concerns over the unabated spread of coronavirus here in Kern County and the Central Valley.
This warning comes as our county's positivity rate continues to be above the state's average. 17's Alex Fisher joins us now with more. Alex?
Yeah, tonight a grim warning from federal health officials about the coronavirus. We are gearing up for a brutal winter as projections show a lot of people could get sick, put in the hospital, and die from COVID. I've been covering the coronavirus before Kern's first case. I've studied the trends and talked with health officials. The consensus, the worst is coming. I'll speak with Dr. Deborah Burks, part of the White House Coronavirus Task Force, in just a moment. She'll talk about her concerns for our area, but first let's look at some of the new models showing where we could be headed. First, let's talk about where we are right now. Nearly 29,000 cases confirmed in Kern County, 222 hospitalizations, and 256 deaths in Kern as of now. Now, let's talk about the widely used IHME study that just came out with a new projection showing that 310,000 Americans could die by December 1st. And things are forecast to get so bad, California will most likely have to increase lockdown measures in October or around that time. By fall, coronavirus will be the #1 killer in America, and that is surpassing heart disease. This study shows more than 40,000 Californians will die by December 1st if the current trends continue. Joining us now is Dr. Deborah Burks. She is the White House Coronavirus Task Force Coordinator, and joining us now to talk about her concerns for the Central Valley. Dr. Burks, I want to first begin with that IHME study that shows a pretty grim outlook between now and December 1st. What are your thoughts? Is this as grim as it looks?
So this is why we have been traveling around state by state over the last, since June 30th, to really meet with governors, local officials, local mayors, community, and really talk about what specifically each state should do. Each state is very different, and so I think you know we've sent out 8 governors' reports, over 9 now, over the last 9 weeks, really ensuring that each state has a very tailored report about what we're seeing epidemiologically and what we think needs to be done by every citizen in that state. And so those are very specifically written for each state to actually prevent what the predictions are right now. And so we are encouraged by the hopeful signs that we're already seeing, but it relies on every citizen continuing to wear a mask, continuing to not gather in large groups, even at homes and birthday parties. We know that those are super spreader events, and really, even though they're outside, we've even seen significant transmission when these parties are outside. So really going into Labor Day, telling every citizen that we can do what we need to do to stop the spread of this virus by washing our hands, wearing a mask, and really avoiding large social gatherings.
You've mentioned your concerns about coronavirus spreading in the Central Valley. Why?
So we've been watching very closely California, and we had a call with all the mayors towards the end of May, and we already were warning LA that we could see an increase in test positivity, and we were very concerned about the LA area. And so when you start to see that increase in test positivity, which follows is increased cases because of community transmission, that early indicator of test positivity notes, and then of course that goes into individuals having to be hospitalized, and then us losing Californians to this virus. So what we've been trying to do is work very closely with every state, that as soon as we see a change, to let states know that we're seeing that change. And so although things are improving in many of the major metros, from LA to now San Francisco is improving, and now Sacramento is improving, we still see rising test positivity across the Central Valley. And we see now, last week there were 15 counties, we now see 16 counties, and we see additional metros in the Central Valley with more than 10% test positivity. And so we really want every Californian to know that there is active ongoing transmission and community spread in the Central Valley, and that we all have to adhere to these guidelines to prevent additional community spread.
Some counties in California have a higher infection rate than other counties, and particularly hit hard is Kern and Tulare counties. Is there a reason why we're seeing such high infection rates? Is it because people are not following the guidelines put forth by officials?
I think there's two things. Counties that have a lot of natural expansive spaces with less population have innate social distancing. And so there's less opportunity for large gatherings and people getting together. In these metros and even smaller metros where there's higher density of individuals, even a few people not wearing their mask can create super spreading events because of the number of asymptomatic individuals that we see. It's not that anyone is intentionally spreading this virus. What we're telling every Californian, particularly Californians through the Central Valley, you could be infected and not know you're infected and innocently pass this virus to others in your family who may have significant pre-existing conditions and may do very poorly with this virus. And so that's why we're seeing this mortality. At one time it was really coming from the nursing homes. Now it's coming really from vulnerable individuals in community settings through this local family spread. And so every single family needs to really, going into Labor Day, ensure that they're not creating these super spreader events in their neighborhoods or among their family members.
We've been talking about the flu a lot lately. We're gearing up for fall, we're gearing up for winter, and a lot of doctors and officials are concerned that the flu is going to be spreading on top of coronavirus spreading. But despite the facts, a lot of people think that the coronavirus is just a bad flu. Is it?
Well, it's been different. It's different because the level of severe disease in particular populations. And so flu may attack other populations to different proportions. We know that it's particularly can impact pregnant women and young children in a very negative way. This particular virus really preys on people with pre-existing conditions, and they have a much more difficult course. And the mortality rates for people that are over 30, over 35, the mortality rates are significantly greater than flu. So this is not flu. I think what's complicating to many people, and I know it's confusing, because it's very unusual to have a virus that goes from very little disease evidence, as in asymptomatic individuals, to mild disease, to flu-like disease, to extraordinarily severe disease and hospitalizations, and a significant number of individuals' mortality and fatalities. That's unusual. So that's why it's confusing to the public. But I can tell you that you can't predict which family member of yours is going to have severe disease. So we all have to protect one another. We know what to do. There's a common sense path forward. Wearing your mask at all times, ensure you're socially distanced, really ensure you're not participating in these large family gatherings or neighborhood gatherings, and of course our personal hygiene. But if you have a vulnerable family member at home with diabetes or hypertension or obesity, you need to protect them, because you're going to have to assume, if you've done any of these things or gone to any of these events, that it could be a super spreader event. You need to protect those vulnerable individuals in your family. That's all of our responsibility. We really have to protect one another, both now and going into the flu season. And everyone can help by getting a flu shot, but what they can really do to help right now is get these cases down right now before we go into flu season.
Dr. Deborah Burks, the White House Coronavirus Task Force Coordinator, thanks so much for joining us.